Hey, hey, over here, all the way over here, all the way over. Come over here by the building. Over here, not over there, not by the. That's not safe. Over here, over here. This patient's going to need some help, and honestly, I don't even know where to start or what to do. What do you think? Hey, virtual reality medic here. So we're in our mass casualty scene. This one can be a little disturbing. Once you go into the mass casualty scene the first time, you really can feel like you're here. I mean, we do have a lot of vocalizations and stuff like that I've turned off at the moment, just so that it's not too disturbing for too many people. But this is an extremely badly injured patient. So one of the questions that came in was a little bit about advanced first aid. Things like, well, I know there was some mention of putting tourniquets on, but it was more about like, what do I do in an area where I can't tourniquet? Well, let's start first with the areas that we can tourniquet. So if you look at this patient, we know for sure that we're going to need to tourniquet this leg, okay? Now, the old thinking on tourniquets was if we put a tourniquet on, everything that's going to be south of the tourniquet is going to be dead within, an hour. No, it's just not true. We know we can leave tourniquets on much, much longer. So it really is better to put a tourniquet on and not really need it than it is to not put a tourniquet on, okay? What's really important is to stop the bleeding as best you can. Now, of course, in a condition like this, we're going to put a tourniquet here. We'll probably put a tourniquet on that arm. Now, that's a pretty high injury, so we're going to have to put it really high up on the arm, and might be a little difficult to get that to stop, to be completely honest, but you really have to do your best. Couple of things that you can use in these cases is if you have some sort of quick clot or clotting agent that you can pack into that kind of a wound, you can definitely do that. However, the patient here, let's say, for example, it's not just the arm and it's not just the leg, but maybe there's some arterial bleeding from, the chest or something like that, or as best we can tell, it's arterial bleeding from the chest. What would we do in that particular case? Well, it's kind of the same thing, right? We're going to do everything we can to hold pressure on that wound. If there's air escaping from that wound, we're going to put some sort of an occlusive dressing on it, okay? And we can talk more about what occlusive dressings would work the best, but really any piece of plastic taped down over top of a wound where air is escaping, okay? If there's any, if we're talking about any type of, evisceration from the belly, there's intestines or anything like that hanging out, the best thing you can do for that, keep those moist, put occlusive dressings around that, but no pressure on those, okay? Putting pressure on wounds, usually when we're talking about chest, like if we're talking about a gunshot or something like that, the pressure doesn't always work. What we're looking to do in that particular case is, if you have it, try to pack the wound as best as possible with your clotting agent, if you're using a clotting agent, okay? Unfortunately, sometimes these things don't work, okay? We do everything we can. The main thing is to keep in mind that it's a terrible emergency, and you're doing everything you can to help the patient. Unfortunately, sometimes that doesn't work. Now, that brings me into a bigger discussion about mental health and mental health care, especially when we're talking about EMTs, paramedics, nurses, firefighters, veterinarians, okay? Anyone, really. We need to talk a little bit more about what we can do to help us all with our mental health care, because sometimes, despite our best efforts, our patients don't survive. Now, I'm hoping that this patient is going to survive, because I'm going to tourniquet the leg, I'm going to tourniquet the arm, and we're going to get this patient out of here. We're going to make sure that we go through and we triage all of our other patients first. And if you want to know more about triage, hey, come back for the next one, okay? I know you may have some questions about advanced first aid that maybe I didn't cover today. Hopefully I can cover some of those for you in future episodes, because the thing about first aid is that it really is ongoing, and there's so much to it. It's so big, okay? The main thing is, do anything you can to try to stop that bleeding. That's what your goal is. First and foremost, stop the bleeding. Once you can accomplish that, then it's get that patient out of there as quickly as possible, because sometimes surgery is really the only thing that can be done in some of these cases. So anyway, listen, it's a hard one. It's a great question. I love the questions. Please keep them coming. And Virtual Reality Medic, I'll see you all on the next one. Hey, take care of yourselves. And for all of my colleagues that are out there on the streets, take care of your mental health as well, okay? All the best to you. We'll see you on the next one.